Hello viewer, you are welcome once again to Health Issues with Dr. P. We've been on the series of prostate cancer. So in this particular episode, we are going to look at prostate specific antigen, PSA. That's the short form of it, prostate specific antigen. You will hear us as a urologist always talk about prostate specific antigen, in the short form PSA. For every man that is 40 years and above, that is of African origin, we advise that you do your PSA once a year or once in 2 years. This is very, very important for all males 40 and above. If it is for the whites, we can say 50 and above. This is because PSA, prostate specific antigen, helps us in detecting prostate cancer early when symptoms have not yet arisen. Know that once somebody starts having symptoms and it is from prostate cancer, most times the prostate cancer has really advanced, has really gone far. So that is why it's good to catch these things on time. So as far as prostate cancer is concerned, PSA, which is prostate specific antigen, plays a lot of role. PSA is different from the size of the prostate. And one mistake that a lot of people make is that they go to pharmacies, they go to laboratories, do their PSA, and they'll say, okay, your PSA is high. Okay, because your PSA is high, we are going to give you so and so medication. Take the medication, it will help to bring your PSA down. And then they will give them medications, and the person takes the medication, and the medication brings the PSA down. But that has not solved the person's problem. Bringing down your PSA, prostate specific antigen level, without solving the problem that has led to the rise in the prostate specific antigen level is not a solution in itself. It's just like somebody that is having headache with fever as a result of malaria going to take Panadol or paracetamol. Panadol or paracetamol can make the headache and fever to stop momentarily, but that has not solved the malaria problem that the patient is having. Not until the person takes anti-malaria medication, that is when the problem of the malaria will be solved. So taking medications to bring down the PSA without finding out why is the PSA high, and then without going ahead to say what do we do to provide a solution to this PSA that is rising, is not the right thing to do. And that is why when you come, we begin to ask them questions, because there's a drug you take and it can reduce your PSA by half. If your PSA is supposed to be 20, it will bring it down to around 10. But that has not necessarily solved the problem. That has not necessarily brought a solution to why that PSA was rising in the first place. So bear this at the back of your mind. PSA can help us in diagnosis, because if once the PSA is high, most times we want to do a biopsy, take request for a biopsy, taking some tissues from the prostate to do a test to know whether there's prostate cancer or not. Because outside prostate cancer, things like infection and some other things can also lead to a rise in the PSA. It is not only about diagnosis of prostate cancer. The PSA also helps us in monitoring patients that are already on treatment for prostate cancer. That you've done a PSA and they say the PSA is high, and do a biopsy and there's prostate cancer, and then you commence treatment, does not mean that you no longer need to do PSA. No, the PSA will also be done from time to time to monitor how you are responding to the treatment. It helps in monitoring. It helps in evaluation of the treatment that you are being offered as well. So the PSA, prostate specific antigen, plays a lot of roles as far as the treatment of prostate cancer is concerned, from diagnosis to monitoring and evaluation, and even in terms of prognostication. It also plays some role in that aspect as well. So as a man that is 40, 45 and above, do your PSA yearly, at most once in 2 years. Keep your record. Have your urologist keep his record. Have your urologist examine you as well. Most times we might want to do what we call digital data examination for you. And if you're already on treatment for prostate cancer, PSA is also very, very important in monitoring your response to the treatment and in knowing whether it is necessary to move from one level of treatment to another level of treatment. Go ahead and share this video. A lot of people need to hear these things and see these things. Go ahead and share this video. Follow us on our YouTube page at Dr. P.E. Ungu. Thank you very much. See you in our next episode.
Is Elios. Welcome to Elios Specialist Hospital, where cutting-edge technology meets compassionate care. Right at the heart of Abia State's capital, number 32 Azikiwe Road, Umuahia, Abia State, Nigeria. Elios Specialist Hospital has become a trusted brand. A known center for endoscopic surgeries, laser procedures for kidney stones, kidney procedures for prostate cancer, which offers the chance of cure for early prostate cancer, amidst other general surgical and gynecological keyhole surgeries. Our team of experts are dedicated to providing comprehensive, state-of-the-art care. Visit our website today at www.elioshospital.com. For more enquiries, please call 0816-3666-022 or 0916-9451-090 or follow us on our Facebook and Instagram at Elios Specialist Hospital. Do well to subscribe to our YouTube channel at Dr. P.E. Ungu, where you'll be exposed to an array of video tutorials and lectures by our MD, Dr. Paul Ungu. Elios Specialist Hospital, Center for Urologic and other minimally invasive surgery.